Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors where we help each and every doctor with his or her career growth. And today we have a very special guest, Dr. Deep Shah. He's here to discuss about dentistry in USA. He's a pediatric dentist and he's going to help us dive into pediatric dentistry. How is it there in US? What is his normal day like? How does he practices from, whether it's a 7-day week or a 4-day week? How is it there? What is it, the general practices that he does on an everyday basis? And how are things there currently, and how's the future there of dentistry as well? So if you want to go to US, this is the talk that you have to listen to. Welcome, Dr. Deep, to the platform. It's really nice to have you here.
Hello, absolute pleasure being here, Dr. Ayushi. Thank you so much for having me.
Yes. So let's start from the start. Why did you pick up pediatric dentistry, and how has your journey been till now from that?
Yeah, so for me, my whole journey kind of started when I was younger. So at the age of 2, I was born in India and I moved here when I was 2. So a lot of people say, oh, you're pretty much, been in the US. Yes, true. But I was born in Bombay, now Mumbai. So I still like to call it Bombay and have Indian roots and a lot of family at home. But when I moved, I actually had ALL, which is acute lymphoblastic leukemia. So I was diagnosed with that at the age of 2. I've been in remission since the age of 5. So it's been 29 years. I'm healthy. It's been great. But that right there almost kind of laid the foundation and kind of planted the seed in terms of me giving back to kids. Luckily for me, I did not have chemotherapy. I didn't have radiation. I just responded to methotrexate, which is like a cancer drug. And so when I used to go back for my regular visits at the oncology at St. Christopher's Hospital here in Philadelphia, I would see a lot of kids who didn't have hair. They're hooked up to their IV poles and very skinny, obviously undergoing radiation chemo, very pale. But there's one thing that never changed. It was this right here. They had the biggest smile on their face. And so as I got into my teen years, I realized, this is a true safe haven for kids. These kids are a lot more worse off than I am, but they're so happy. They're in their element and they're in their zone. And that's kind of when I realized I wanted to go back into peds and at least give back, to the community and give back to kids for the doctors and the nurses that took such great care of me and my family. And the whole medicine dentistry kind of ordeal happens, which I'm sure happens with many folks. The biggest thing that drove me into dentistry was, I think, the autonomy of the practice itself. And then I'm also ambidextrous, so to be able to use, both hands, manipulate the hands and work with the hands, I thought was very important. And the last thing for me was instant gratification. I love that feeling of someone coming in if they're in discomfort or in pain, and they walk away feeling almost like a breath of fresh air. And so those 3 reasons really resonated with me, which is why I ended up choosing dentistry. And then through dental school, like I said, with my love with peds, with my background with pediatrics, kind of was a no-brainer.
That's such a nice story to know what inspired you to get into it. So now understanding, how is the education system in US? How can a person go for specialization and go further?
Yeah, so you're gonna do, here the schooling goes up to 12th standard or 12th grade. Then you go for 4 years of your undergrad degree. Following your culmination of your 4 years of undergraduate, you'll go to your post-grad program, which is your dental school. So that's another 4 years. So that puts you at 8 years. After you graduate dental school, you can go on to be a general practitioner. Most people will do at least a year of fellowship or some type of GPR program to get a little bit quicker. Dental school is great, but obviously those 4 years, you're not going to train you for the real world 100%. So a lot of people, if they want to do general practice, will go out and spend a year or 2 just working on their skills. And then obviously there's so many different routes of specialization. So for peds personally, I'd end up doing another 2 years at a children's hospital in Pittsburgh. So I'd put a total of 10 years. If you're doing ortho, that's 3 years, orthodontics. Oral surgery can be either 4 or 6 years, depending on if you're getting just your, DMD, DDS, or if you want to get your MD, then the MD program's the additional 2 years. There's PROS, there's Perio. So there's all these different programs. So depending on your interest and your passion, your purpose, you can go any one of those avenues. So at least a minimum of 8 years. And then after those 8, wherever your specialty guides you.
Great. Nice to know. So now when it comes to, oral surgery, so oral surgery, is it that we have to get a medical degree also to practice oral surgery with US?
You do not. So there's a 4-year program where you don't need to get an MD degree. If you choose to go the 6-year route, then you will get your MD. Yeah. So then with those 2 extra years, you're in school with medical students and things of that nature. So there's a 4 or a 6-year option. The latter will get you your MD degree.
Okay. Okay. Great. Great. Nice to know. So just after passing out, how is the practice scenario there in US? Getting your first job and, getting into a good place is something that, is wanted to know, how difficult it is.
Yeah, it's when it comes to job hunting, I always say that there's three things that that everyone looks for. And it's really hard to get all three, but you're trying to get all three. Scope of practice, salary, and location. So getting two out of the three is usually what everyone strives for. That's the best situation scenario there. So it just depends on kind of what you want and what you're looking for. I think to get a job is not the hard part. It's to find a job that really matches your values and what you want and the way you want to practice. That can be a little bit of the challenge. And so that's kind of where usually your first job, people come out, you want to get your feet wet, you will compromise certain things. And when I say compromise, absolutely not compromising ethics or integrity. Although there are some places here that do certain things that are not ethical, I'm sure, as any place in the world. But you will compromise maybe salary. You may compromise your location. You may commute an hour to go to work. But those are all things I think in the beginning anyone will do just to, kind of make a living and advance their career, so to speak. And then at that point, my biggest thing is as time goes on, one other thing increases, and that's your self-worth. And when your self-worth increases and you get a much better understanding of kind of the field around you, then I think people end up being more picky and choosy. I certainly was. And that gave me the ability, the salary will eventually come. And I think you and I talked about this before we got on here, is that if you have your passion and purpose, the money just comes, but if you're focused on money, then you'll never be satisfied. And so let whatever your passion is, let that guide you. And then, like I said, I have never heard of a dentist who starves. And I always make that joke because everyone's well off, but it's more about being well off. It's how can you serve others and how can you serve your community? And so these are things I think that a lot of people will find out through their first and second job. But to answer your question, to wrap it up, I don't think it's very difficult to find a job. It's just, it takes a little bit of patience and just kind of going through and working on yourself in terms of what you really want in your ideal job.
Correct, correct, correct. So now understanding, this is something, a very normal route that I believe you must have gone through. But an international dentist who plans to come to US and start working there, how is the education system different for them, or not biased for them, as well as hiring agencies for them? How do you think it's different for an international dentist than for a person who is there, especially who does not have a green card in US?
Yeah, I think it's a good question. I've never been in that situation, so it's kind of really hard for me to see the differences. I've had a lot of friends. So I was going to Penn. We had 35 to 40 international students. A lot of them were from India, and so I do have like a little sheet here that in terms of how to get the biggest thing here is as long as you're in good standing, you're fine. You can work. You're eligible to work. Getting into dental school, you want to look. Well, let's back up and we'll say how to get into a dental school here. What you want to do, obviously, there are a few schools they'll have a good standing program. They call it the PASS program, and it's for foreign trained dentists who want to get their US degree. I think there's a list of like 38 schools. Penn is one of them. There's Columbia. There's like Loma Linda, San Francisco out west. For people who may have family in the West Coast, but they're all across the U.S. To get to those schools, I think you had to have a pass your TOEFL score, I believe, is one of their requirements. And then once you do that, you'll take your NBDE Part 1 and Part 2. So the good thing is that you can skip the entire first 2 years of dental schools, which is all didactic, just by taking those 2 entrance exams. And once you once you complete those, then you join in for your 3rd and 4th years to do your clinicals. Once you finish your clinicals, you have your degree. So the biggest thing, like I said, is good standing. So if you cannot get into dental school outright, which means that the dental school cannot sponsor you in terms of you being a student at the dental school, then a lot of people come in, they'll do their MPH, they'll do research, and then they'll be in good standing, and then they can apply to dental school that way. The other option here is, you can have a form of F1 visa, for example, which is what the schools give you. And then you can either have an H1, or if you don't have an H1, you can have an H4, which means you have to be married to someone who has an H1. So those are all different scenarios in terms of how you can, be in good standing. And then once you're in good standing, you can work. So then it doesn't become an issue. But those are a couple of the different avenues to go around.
Yes, yes, yes. Actually, especially I believe when it comes to job front, it gets difficult because you need to have an employer who sponsors your visa. So getting that job do you think it's difficult, if you have any of your colleagues, international dentists?
It can be. I think that's one of the reasons why, and I'm just speaking off experience. I haven't gone through this, but I know a lot of my colleagues have ended up going to Texas. And I think at one point, this was about 5 years ago, Texas was a very booming market down south, and they would have a lot of employers that needed dentists, and so they would sponsor. So I think as long as you have that understanding, that relationship, and depending on the company's needs, I think it is likely for them to sponsor you. I also think it just depends on location specific areas as well. So going into a bigger city might be difficult, but if you're in a rural area or more of a rural area or countryside, then I think that might be a little bit more feasible, or in a town, you know? So I think it just depends on where. But is it a challenge? I do think so. I do think it's a little bit difficult to get sponsored by a company. So I think the more that if you're able to handle on your own and get these things set up, I think it just lays that path and that foundation a little bit easier for you.
Correct. I completely agree. So now, getting back to, practices, after understanding how is it different for international dentists, what we know that you are a chief dental officer in a, and are somebody who is in a very good position of a practice. So how is it different, having your own practice and, working as a dentist in a practice? It's very different here in India. So just wanted to understand, how is it different in US?
Yeah, I mean, it's different. I think lifestyle and I think the timings are very different. I was speaking to a dentist in Gujarat, and I believe during the work day, half the day they take a break. So you come in for a couple days, a couple hours in the morning, then there's a nice like a gap in the afternoon, and then you work at night. Here it's very different. You're not going to get that afternoon break. You'll have a lunch break up to like maybe half hour, an hour, but there's no extended period of rest time. So for example, I can only speak on my behalf. My schedule is the days that I'm teaching in academia can be either a 8 o'clock to 5 o'clock day, or it's an 8 o'clock to 12 o'clock day. And then I work with the residents, and our whole goal there is to help them lay the foundation in terms of delivering exceptional pediatric care. And then I run the oral conscious sedation program for them at Penn. On my end, when I'm at practice and in the private practice setting, I start at 7:30 and I'm done by 3:30. And then I personally love it because I have the entire rest of the day to come home and spend quality time with, my wife and my 2 boys and our dog. So it's really, really rewarding in terms of how much time that I get personal time off that way. Biggest difference, I would say, in terms of care, I think there's just a huge focus on preventative medicine here in the US compared to India. Once again, I have not practiced in India, so everything that I'm saying is just based off talking to colleagues such as yourself and other colleagues that I have all across, the different states in India. So I know that preventative has always been a big issue. That's one of the things that here I think is done pretty well. We have insurances. I work at a fee-for-service office, but majority of the offices here are not fee for service. They will take insurance. And so you always have that to bounce back on. So especially with kids are so well taken care of in a way that, if you don't have fee for service and don't have cash, you can get onto a Medicare kind of Medicaid type of program. And that can help, and assist you with fees and things of that nature. And there's a lot of dentists who participate with those programs. So I think getting every kid seen twice a year is really, really pushed, and it's quite honestly done very well here. And so I think that's one of the biggest challenges, in terms of just care. I would say care otherwise to me is care, right? I think everyone learns the same, fundamentals, and your education is, excellent. But I think that's probably the biggest barrier, maybe the barriers and the access to care. I think it always comes down to that. Why is a child not coming for their care? Why is this child only coming to see me when they're in pain? How can we prevent this? And I know one of the biggest thing I would love to see on my end, I would love if India increased their GDP and putting it towards healthcare instead of 1%. If we can bump that, even double that to 2% and go up to 5%, a little bit more money in that sector, I think would take it a long way.
Mm-hmm. That's completely true. So now, when coming to GDP, how does, what I understand, US has around 12 to 13% GDP towards healthcare. So how is it that, apart from insurance, how is it that it helps in the healthcare system to grow it better?
I think it's just a lot of like money towards research, money towards advance. A lot of these schools that'll do research, but then a lot of these companies that'll invest in dental research, dental tools, dental products. I think that's kind of mainly where it goes. Like this, the intricacies I'm not too sure of, but I can tell you that there's so much research going on, and then a lot of that money is sure going to dental schools and innovative technology. But I think that's kind of the focus, is what's the future of the dental field, and I do see a lot of money being invested into places like that.
That's really nice to know. So now and I completely agree with you, there is a challenge of awareness and towards preventive healthcare in India, especially for kids. Helping families understand to take care of milk teeth is a bit of challenge still in India, and we as dentists actually try to imbibe that again and again, but it's different here. So now what are the kind of challenges there in US? There is a set of challenges in India as a dentist, so what are the challenges there in US and what do you face?
Yeah, I'd say like for me personally, the challenges are, I think, parents who just really they want the sun and the moon, and you want to give them the sun and the moon, but you can't because their child is not ready to have the sun and the, you know what I mean? For example, there might be a child, parents are very into aesthetics and they want all white zirconia crowns. And as much as I would love to do that for their child's occlusion is just so crowded that it's a nightmare. So I'm gonna have to do stainless steel. Maybe I can do 1 or 2 zirconia in the back, but like I need stainless steel. And it's just, I think sometimes the expectations and the lofty expectations don't meet reality. And I think that's kind of the biggest thing on my end that I have seen is that's the challenge. Lawsuits and stuff, I really haven't heard of many like lawsuits. A lot of people think, like the lawsuits are, must be so bad because your malpractice is high. And that's true, malpractice is high, but like I said, knock on wood, like I haven't had any lawsuits myself. I don't know anybody around me, any of my colleagues, no one that faces a lawsuit, just because your avenue and your protection is also, it's there for the dentist and the professional. So they're really looking out for your back. But that, once again, my biggest thing is ethics and integrity. You should always be doing things that line up with your values, 100%. But I would say, yeah, I would probably is the biggest challenge is how do you create environment that you're able to do what you want to do, but also satisfy sometimes some of these parents who can be a little bit difficult. And nothing wrong with difficult parents. I do think, once again, it comes down to understanding, lack of education. They didn't go to school for what we went to school for. They just want what is in the best interest of their child. And I understand that. But sometimes they also need to understand that, hey, listen, like based off of our situation, X and Y is feasible and Z is not. So let's work together and come up with a solution.
Yes. So this is, I believe this is everywhere in the world, parents actually try to give the best to their kids, and
100%.
that pediatric dentists are, more facing that more than any other specialities. Yes.
Yeah. I would say the other thing, the one other challenge, I think is just the debt. And I think that's a big one that I failed to hit, is that I think the amount of debt that the average dental student comes out of is just ridiculous. And to open your own practice, if that's what you want to do. Now you're adding anywhere from opening a new practice is like $1.5 to $2 million to open your own practice. That's a lot of money if you're already in like $400,000 worth of debt to begin with. So sometimes it feels like this vicious circle of debt just never ends for a lot of people. And so I think, money management is difficult. I do wish one of the biggest things that I have a problem with is dental schools not talking about finances in dental school. I wish they changed the culture of that. And they really help people understand, hey, money management, how to become financially savvy. And I think that would go a long way just for people to understand, how to manage your money. That's the biggest thing, is that you're going out there, you're making money, but then you're taking this money, investing in somebody else who's going to handle your money. Whereas you should also learn at least a little bit about how to manage your own money, so you don't fall into the cycle. So those are, I think, some other outside of dentistry, but I think also kind of tie in very nicely. Those are some big problems I see here.
I completely agree. So, this is common. Here in India also, we do not teach and talk about, finances management. Although we do not get into this heavy depths, but yes, education is costly here. So, and actually managing finances is not that easy, definitely, and we are not taught to do that. So this needs to be taught, definitely.
Absolutely.
So now understanding, now you are also an academician in one of the dental schools, and it's amazing that you manage everything, from becoming an academician at Pennsylvania School of Dental Sciences, and as well as being a regular dentist. So how do you do that? And managing a lifestyle, how is it difficult for you to manage, as well as take giving time to your kids, to your family, as well as being a good dentist, as well as a teacher? So understanding your management of time is something we want to discuss.
Yeah, it's a great question. We're talking. I think it's tough. I wear three hats. So yeah, I'm in academia. I practice, and then I'm the chief dental officer of our company. So it is very time consuming, but it is very rewarding. And I think we talked about, as long as I'm, passion, purpose, and intent, and if that drives you, I honestly think the rest is easy. When I'm in there, I have 110% of what I do. I think the biggest thing is just not mixing work life and professional life. My home life is my home life, and I go to work. If the kids drive me crazy one morning, thank goodness they're sleeping right now. But if it's a crazy morning, I won't let that energy get into, with my patients. And so separating that, I think, is very key. It's something I've become good at. But I think the biggest thing for anybody to, do well is just to have a routine and a structure. And I think for me, it starts early mornings. We were talking before this. I wake up at 3:45. I go to the gym at 4, and that just sets the tone for me. I get to meditate, work out, and that right there is all the positive energy that I need to kind of get through the day. Working with kids, a lot of people think it's challenging. I think it's fun. I think you have the ability to shape a small human's life, and you can have an impact that can last them a lifetime. And so with that mindset, and if I can take that mindset to every patient I see, my goal is, how can I change them? How can they walk out of here being their own superhero, which has kind of been my motto. And so when you're able to have fun with what you do, the rest just kind of unfolds itself. The biggest thing here for me is just my schedule. So because I, do a lot of sedation dentistry in the morning with children, my day does start early. If I'm not doing IV cases, then my normal day starts at 7:30, which is majority of the time. Otherwise, with those IV cases, we start at 5:30, 6 o'clock, and then I'm done by 3:30. So I have up until from like 4 o'clock, 4:15 when I get home, all the way until the evening to spend a lot of QT with my family, with my dog, with the kids, with friends and things of that nature. So I think that work-life balance can be tough, but I think we've gotten to a point where I'm able to structure it just well, that I'm able to, be mentally happy, emotionally happy, and physically happy.
Great. That's nice to know. So now when you talked about, conscious sedation, the sedation that you normally practice, and so how do you decide, what is your, how do you plan on going for conscious sedation? So here in India, I know many dentists who do not do it on an everyday basis. There are selective patients that they do forward, that they, go for, and everybody has their own, way of analyzing, which patient to go for sedation, which patient to go for a GA, or which patient to, to treat it, in a normal scenario. So what are your checkpoints to analyze?
Yeah, it's a great question. Very loaded question, because it's like a whole separate conversation. But if I can wrap it up into a nutshell, I use 3 medications. I'm just going to talk about this because I know you have a lot of dentists who listen to this. So I use Demerol, hydroxyzine, and then Versed. Not all 3 together. Sometimes I will do a triple cocktail. Sometimes I'll just use Demerol and the hydroxyzine. Sometimes I'll use Versed. Sometimes Versed hydroxyzine. So it just depends on what am I trying to achieve that, with that particular patient. I look at a few things. Obviously, biggest thing for me is an airway assessment, which is part of my score. So they can be a really great kid, a great candidate, but if their Mallampati and Brodsky score is like 3 and 4, they have sleep apnea. These are all these questions that I'm sure all of us do our due diligence and we ask. Then that's going to take me into another realm, and they may have to be a general sedation case. For most of these kids, in terms of what I'm using, what's their behavior like? Are they able to take radiographs? And then what's their treatment needs? Those are kind of the 3 things I'm looking at. This is apart from medical history and all that stuff, which I'm assuming I've already gone through. But then that's what I'm looking at in terms of what medications I'm using based off of those 3 realms is going to help guide what I'm using. That's in a nutshell. If I keep going, I'll just be very specific. And like I said, the way I do things will be very different than someone else, and there's no right or wrong. It just comes down to matter of preference and your comfortability with the medicine. But I love, I'm totally okay getting these kids into it, obviously anxiolytic, but getting them a little bit on the moderate to deeper side. And I'm comfortable with that because of my training. Some people I know are not comfortable, and that's okay. The biggest thing I say is do what you're comfortable with, and that's the most important thing. But those I have definitely found, for me, it's a great avenue when nitrous is not enough and then IV or GA is overkill. This is a nice happy medium for a lot of these kids that I see who are able to get the treatment done while still being in a little bit of a twilight, so to speak.
Nice to know about this. How do you analyze kids?
Yeah.
So now, again, understanding, with India for consultant for specialists, there are times that we are being called on the clinics, for the patients. And so it's very different here in India. We specialists at times visit different clinics. and treat patients. So instead of calling them on their own clinics, so there are different setups, and we go and treat it there. Or yes, we have our own setups also, but it's very rare that patients send their patients to to your setups. So how is it different there in US for specialists?
Yeah, that's right. That's so cool to hear. I mean, that you guys go there. I think the concept is still the same. There's a very interdisciplinary approach. We also have, even, I'm sure with you guys, a very multidisciplinary approach where we'll have different specialties outside the realm of dentistry and medicine, ENT consults, plastics, all of these things that we combine with pediatricians, for example. But when it comes to interdisciplinary within the field of dentistry, our concept is the exact same. The only difference is we'll refer out. So instead of us, if a child needs their wisdom teeth out, for example, we'll refer that child to the oral surgeon, and the parents and the child will make an appointment to go to that specific office. If the orthodontist, if we want to refer them to the orthodontist, and if you don't have an orthodontist that's working with you, a joint practice, then you'll refer that child out to the orthodontist, for example. So everything is very location specific, so to speak. Mm-hmm. If I see a child is 8 years old, front 4 adult teeth are in, but there's a lot of crowding issues, and I think, hey, this child might benefit from a rapid palatal expander, let's say, then I'll refer them to the orthodontist. Instead of me, going to the orthodontist office and explaining everything, I'll have a referral form, we'll write everything out, and then they go to the orthodontist. So the approach is the same in terms of what we want to accomplish with the child, but instead of going to the other location, everything gets referred out, and we have this almost web where you have this interconnected web, but each web at the endpoint is another office. So I can refer to the oral surgeon office here, orthodontic office here, perio office here. But the general gist, like you mentioned, is the exact same.
Okay. So now understanding, when you mentioned that, it is very location specific. So is it that, the number of dental clinics are being controlled by the government? For example, there will be just 2 dental clinics or 3 dental clinics set up in Pennsylvania, not more than that. Is it something like this also happens there?
No. I mean, I think the reason why you'll have some specialties, which are my very first job was in multi-office. So we had orthodontists, pediatrics, special needs, and general dentistry in one office. We would call the oral surgeon in. We'd have a mobile oral surgeon who comes into that office. So kind of the thing that you're seeing, some of these places will have a one for all model. So bring your family, bring your kids, like we do everything under the sun. And that has its pros and also has its cons as well. It depends. A lot of your bigger clinics are your institutions. So when someone wants to have, work done at a lower price, then they'll go to a dental school. And here in the Pennsylvania, state of Pennsylvania, there's University of Pennsylvania, there's Temple University, and then there's University of Pittsburgh. So we have 3 major institutions, depending on where your location is, where you can go to these clinics. The work is going to be done by dental students or residents. So what are you compromising is probably experience and time, because it's going to take them a little bit longer to do everything. Hopefully you're not experiencing quality of care because all of these students have mentors that are overseeing them, but your time is a bigger factor. So if you want to come in and have an implant done, it might take you the course of a month at one of these institutions. Whereas if you go to private practice, you're done maybe within 2 or 3 visits. So that's where your institutions will be. Other than that, opening your own practice, usually not an issue. There's no law or rules prohibiting you from doing that. Opening 1, opening 2, opening 3, just a matter of preference.
Okay, great. Yeah. Nice to know. So anything from your end, understanding about the future of pediatric dentistry in US, how is it changing from the point you graduated to now? How do you see it evolving, and how do you see, the greater opportunities opening up for the students now?
Yeah, it's a great question. I always say that the needle in medicine has to move, no matter where you are. So it's good to see things moving, and I have seen things moving here. Biggest thing in terms of research, for pulpotomies, back at the gold standard, formal creosol, ferric sulfate, maybe just some lidocaine. MTA has become a big thing. And for me, working in the university, this is what I really like about academia. I'm kind of abreast with, the upcoming advancements in terms of what we're doing. So obviously we've been using MTA, but we're also trying to find different products to use for children. Zirconia has become a huge thing. I do a lot of zirconia crowns and aesthetic dentistry on children as well. Collaborating with co-cases. One of the beautiful things about working in academia is that if a child has severe anxiety, but they need a root canal on number 8, we can sedate them and have the endo department come in and do a co-case with pediatrics and endo. And that's really, really cool because in private practice, it's really, really hard to do that. Unless this child is going under general anesthesia, then everyone meets up at the hospital or the surgery center and they, provide a multi-care in a facility like that. One of the coolest things that I see that I'm doing that I also see really being the future of pediatrics is a lot of airway management. So a lot of, appliances, if we can catch kids early, and stem cells in that PDL ligament of the tooth. And if we can get a mouthpiece on a 3-year-old or 4-year-old, it shakes, kind of the teeth vibrates and helps the stem cells and kind of helps to naturally expand. So these are some cool concepts and things that are coming out, which is really neat to see how things progress. I do use a laser, so I do a lot of frenectomies. And like I said, not every frenum needs to be released, but from my analysis, the ones that do, that's been life-changing. And to see a lot of these facial profiles, which initially a lot of kids who are chronic mouth breathers become very, kind of dolichocephalic and elongated face. And so trying to catch that early, helping parents understand the implications of mouth breathing. I think there's a lot of this kind of medicine functional dentistry is the right word to use. I think I see functional dentistry kind of coming to the forefront in the very near future.
Mm-hmm. That's really nice to know, and understanding about these stuff actually excites a lot. So
Yeah.
So that's great, So something, ending this on a high note, anything that, keeps you motivated every day on your passion. So that keeps you going every day.
Yeah. Oh my gosh. There's so many things. I think, obviously my family and like my own health. I always say, if I want to give 100% of myself, I have to make sure I'm at 100%. So that means making sure that my mental health, my physical health, and my emotional health is as the love cup is as full as it can be, right? Because that's the only way that anyone in the world can give 100% of themselves back to somebody else and really make an impact in their lives. For me, I think my foundation, my motto has always been be your own superhero. So for anyone listening right now, we're all, because we're saying we're all in the situation that we're in because of our upbringing. We all have our insecurities. We all have our own childhood traumas. And my whole goal is when I go to work, my goal is how can I make my work environment a safe haven for these kids so I can minimize any traumas that they're having in their life. I can minimize any insecurities that they have, and that they really feel comfortable and confident, and they walk out of there truly being their own superhero, and kind of helps them set that foundation for them in their life. And so that's, I think, what really, really drives me is how I'm able to shape and help mold the mind of today's youth, because today's youth is going to be tomorrow's future.
Correct. So correctly said, and so inspiring to know, this is completely true. And that actually helps. It's important for we as adults also to believe this, that we are our own superheroes, and we can actually fight everything that we want to.
Absolutely.
So, thank you so much, Dr. Deep. It was a real fun conversation. I actually knowing about everything there, as well as enjoyed a lot. So understanding everything. So thank you so much for taking out time. I know it's early morning there, and Sunday early morning we have been disturbing you for this conversation, but it was really nice. Trust me.
It was my pleasure. No, thank you so much for having me, and keep doing what you're doing. It's very inspiring, Dr. Ayushi.
So much. Thank you so much, everyone, for joining us at this time. Do share it with your friends and colleagues, all those who want to go to US. This is something that will definitely inspire them, as well as do follow us on our Instagram and YouTube channels, as well as if you want to see Dr. Deep and want to have any questions with him, he's there on Instagram at the superhero dentist. So you can actually find him there and see his amazing photograph as an Iron Man or any superhero that you follow for his patients. It will be really fun for you to watch his photograph. I had real fun. So and if you have any questions, do reach out to him. He will definitely get back to you. Thank you so much, everyone, for joining us today. Thank you so much, Dr. Bye bye, everyone.